There you go. Okay, everybody, welcome to An Englishman, an Irishman, and a Load of Bollocks, our podcast. It's me and Paul with you for, I think this is podcast number 10 now, and we're going to talk today about the nurses' strike in the NHS. Paul, I've got to be honest with you, this makes my blood boil.
Yeah.
Yeah,
I
it does.
can only imagine. Nurses are always looking for money, aren't they?
Well, I think that's it. I think this is when you scratch beneath the surface and get past the mass messaging, the mass adulation, the ideology that underpins everything about the NHS. When it comes down to it, it is about money. And that's okay, from one angle, people need money to live, and there's a place for unions, and there's a place for, for workplace solidarity and all the rest of it. But for me, the two
it's the timing, isn't it?
It's the timing of it, and it's also the demands, and it's also the context set against what's happened in the last few years. And also, 100%. There's nobody who loves money like a socialist. The socialists, they love money, money more than any capitalist, to tell you that. And the NHS, as far as I can see, is stock full of socialist thinking, socialist policy, and socialist individuals, which makes it very, very ironic, the extortionate demands that they are placing. As you know, Paul, I detest this government. I detest all politicians. But what I think a lot of people might miss is that, yes, the NHS is being run into the ground. Of course it is. But that is being done in tandem by the government, or governments of the last couple of decades particularly. But even more so, this is what people maybe don't see, is it's being done with the buy-in of NHS itself and the staff within the NHS. Whether they are the useful idiots working in the NHS, or the psychopathic nurses who have done the most unspeakable things in the last couple of years, or whoever that may be, and there's a lot of good people in the NHS, but I'm sorry. There is, but I'm sorry I've come to the conclusion that it has been taken over by this horrendous kind of like communist ethos, really.
Nursing unions, albeit might have good intent, but they've become weaponized in recent years. They're run by the wrong people with hidden agendas, and as you said, they have a socialist outlook on things. From an Irish context, when I see nurses, my background is nursing. I'm proud to say I am a nurse up to a point. The last 2-3 years, very much let down by how nurses reacted, or in many ways didn't react. But when I hear nurses protesting about money and looking for extra demands, I look at that in a few different angles, especially the last 2-3 years. We had a guy over the health service in Ireland, our equivalent of the NHS, the HSC, a guy called Paul Reid. He's no longer there anymore. He did the rounds of all the hospitals in Ireland, had his picture taken with nurses, and they're all happy clappy, everyone was smiling. This guy was on €420,000 per year, 420,000 per year, the head guy over the Irish Health Service. And add to that, Dave, he gave himself a little old increase. And nurses were happy to get their picture taken with him. And I'd issue with nurses in terms of, why would you get your picture taken with this guy? You should have been saying, no, we don't want our picture taken with this guy. He doesn't have our interests at heart. Another thing I've issued as well is, in the last 2 years, because of lockdowns and because surgeries were cancelled, there's 1 million, our population is 5 million. There's 1 million people in Ireland now on a waiting list in the country.
Wow. Because,
as I said, of surgeries being cancelled and because of lockdowns. And who added to that was nurses who were silent and complicit in the last 2 years by not questioning anything. And now they have the audacity and cheek to complain that they're overworked and complain that the health service is overrun now, and to demand more money, when, aside from the tragic human aspect of surgeries being cancelled, there's also a financial impact that would have cost millions upon millions, surgeries being cancelled, and the knock-on effect of that. And one last thing, just about the health service, we have had a 17% increase in mortality in the last year. 17% increase. Where are the health service providers talking about that huge statistic? A 17% mortality increase. No one's going there. No one's talking about it. You know, so yeah, it's the double standards is unbelievable.
Yeah, Paul, you've what you said there was so much to unpack. First of all, I think the context for me is everything here, both
Yeah,
in terms of the average nurse's pay, the expectations upon a nurse,
yeah,
and what they have been asked to do and largely have done in the last couple of years. So first of all,
yeah,
the pay. I mean, as far as I can see, you know, your average nurse's pay is a lot higher than average. It looks pretty decent to me. You
it's
know,
good.
yeah,
Yeah,
it's good.
it's same in Ireland.
Yeah, you know, I'm
The
hearing a
starting
lot of
wage of
things.
nurse is it's very good.
Yeah, exactly. I'm hearing a lot of cries about how we poor nurses going to be able to put food on the table, how are we going to pay for
Yeah,
our heating bills, all the rest of it. Now,
yeah,
you know, I get those points, but you know, have a little bit of awareness really about, you know, the fact that
yeah,
setting the grand context of things, you know, your
yeah.
wage is significantly higher than
Mm,
the majority of people actually who are working in this
mm,
country, and it'll be the same in Ireland as well. The context
yeah,
in terms of
of course.
what they are demanding as well, between 17 and
Yeah,
20%. You know, they talk about it's going to be backdated over the last few years and use
yeah,
these very
yeah,
nebulous terms relating to the economy. At
yeah,
the end of the day, they're trying to hold the government to ransom to get as much out of them as they
yeah,
can.
yeah,
Now, I
yeah,
remember back not so long ago where nursing was, you know, people went into nurses not out of ambition, but out of a vocation, you know, and they weren't.
100%.
Yeah, there was such a thing as the Hippocratic Oath. There was such a thing as,
Yeah,
you know, pursuing values rather than pursuing
yeah,
agendas. And that brings me
yeah,
to my last point about the whole context and background to this. And I just want to qualify as well by saying that I know that it's not every NHS trust. I know it's not every
yeah,
nurse.
of
Far,
course,
far
of
from it.
course.
Far from it. I'm talking about the ones who have decided to strike. But the
Yeah,
context is, let's not put too fine a point on this. Let's actually say what what has happened in the last couple of years, namely, as you say, lockdowns, which included the locking down of hospitals,
yeah.
which
Key
included the
surgery.
withdrawal and GP surgeries, which included the withdrawal of cancer screenings, which
Yeah,
entailed
horrific.
horrendous policies involving
Yeah,
parents not being able to visit their sick and dying
yeah,
children who
yeah,
died alone in hospital by themselves, which entailed
yeah,
pregnant women giving birth to their children
yeah,
wearing a face mask, and the biggest one of all, which involved a what should we call it, the black magic potion being pushed on the
yeah,
population, largely by the NHS,
yeah,
largely by nurses. So the fact that it's the staggering lack of awareness, self-awareness, really, and
yeah,
also their place within
yeah,
society set against the context of, well, what's the average wage? You know, it is
yeah,
absolutely the temerity that they have. I did a video for my YouTube channel not long ago, Paul, saying, you know,
yeah,
I think there's a special place in hell for these nurses who strike. I really do. I think they're wicked. I think they're so driven by anything other than altruism and compassion, whatever the opposite of those things are, because I just can't logically explain it in any other way.
You mentioned that nursing used to be a vocation, and you're right. It used to be one of the most noblest vocations, but nowadays it's a profession, and I put that in inverted commas, profession. You go to university, you get your piece of paper, and off you go on the nursing road, you know.
Yeah.
And Florence Nightingale has a famous quote of how very little this is, and it's apt from the last 2 years. How very little can be done under the spirit of fear, and nurses should remember that. You know, the founding lady of modern nursing was, and I'll say it again, how very little can be done under the spirit of fear. And the problem is, in the last 2-3 years, is Most nurses weren't afraid of the so-called virus, were they, Dave? They were afraid, nurses were afraid of their managers. They were afraid of what others will think of them if they question things. So nurses in the last 2-3 years, they knew what they were seeing on the ground. They knew there wasn't a killer virus out there. But unfortunately, and we said this before, the worst people out there are the people who go along to get along. And do we want a health service where we have people, and nurses are the heartbeat of the health service? Do we want a health service where nurses are on the ground and they turn a blind eye to things? They toe the line. They toe the political narrative. They ignore things. No, we don't want nurses like that. You know, the real trailblazers in the health service, the real tough, courageous nurses in the last 2-3 years have been the nurses who said, no, we're not taking this job. No, I don't agree with the mask mandate. They have been the true heroes because they're principled, they're brave, they're courageous, they're critical thinkers. My kind of view in nursing is to be, look, as I said, my background is nursing, and it sounds corny, Dave, but you go into nursing to be, you know, to be the eyes for the blind, the ear, to be a helper for the helpless. You go in with that attitude and it's also, you take on the responsibility that it's a very serious job. It's an honor to look after people. It's an honor to look after people who are maybe dying, or people who are sick, or people who are unwell mentally. It is an honor, but you also have to ask questions. And sometimes, Dave, you have to be managers. A good nurse is always a thorn in the side of managers. You're always a thorn in the side of the hierarchy in the health service, because you're a critical thinker. You're asking questions. They're the nurses we want, not, as I said, nurses who, as we said, go along to get along. And that's what we've seen, unfortunately, in the last 2-3 years. As I mentioned before, Dave, we've got 70,000 registered nurses in Ireland. Now, albeit, I'm sure thousands of them didn't comply with the mandates, and they were heroes in their own areas. And you could imagine the intense pressure they had to deal with.
Oh, God,
and they held firm.
And
I know the NHS were going to push mandatory vaccines on NHS staff in London, and nurses were saying, no, we don't agree with this. They're the nurses that we should be embracing. They should be the future of nursing.
Absolutely agree everything you've said there, Paul. I think you were talking about the values of the profession, and you were also talking about the critical need to be able to challenge and ask questions, not be an obedient fool, because you know what people are like. You know what any organization's like. You're gonna get your you're going to get your psychopathic manager. No matter how much you try to stop it, you're always going to get the people who are going to end up at the top, who are the most ruthless, who are the most dangerous, actually. And that's just the way it is. It is incumbent on anybody working in any organization, really, to be able to have a modicum of courage to try to keep those people in check, because there are some people who really are just there for themselves. Now, I can certainly make the argument that a lot of these nurses who are striking, maybe, they're probably not psychopathic. I'm not going to say that, but it's almost like they've sold their souls via selling their values, if that makes sense, by selling themselves out to, and you know what, selling themselves out to cowardice, but also, and this is the ironic thing, is the NHS certainly in the UK is very, very socialist. It's a very socialist outlook. It was a socialist enterprise to begin with. It's predominantly left wing.
It was good in theory when it was first brought out.
It was good of course it was, when it was underpinned by some actual medical values, it was, and some scientific values and altruistic values. But the what are the underpinning kind of concepts of socialism is around the unhealthy pursuit of money and how much they are against that. So at the same time that we've got a lot of left-wing activists within the NHS, nurses, managers, doctors, practitioners, kind of eulogizing these socialist kind of woke, all the ideological, social justice kind of like values that we talk about a lot. Well, at the same time, they've been doing the bidding, Paul, of massive private interests, big pharma by the jab, the testing kits. I mean, who produced them? Private companies. All the PPE, who produced all that? The private companies. So yeah, it's true. Whilst they say that the NHS is being sold off to the highest private bidder. I mean, it's very complex, this conversation, but yes, that's true. But that's on you, that way, because what are you doing to challenge it? Because you're endorsing the products that these private companies that are working with the NHS are providing. Does that make sense?
And in many ways, nurses, we're just going to talk about nurses here because we're talking about the nurses' strike. They've been propping up big pharma because who endorses the medical model of healthcare? The medical model of healthcare is both doctors and nurses. Who gives the medication? Who gives the vaccinations? Is generally nurses. And not once have they said, again, I think I talked to you before of going into nursing. I'd be a mentor to student nurses, or I used to be. And I always go, Kipling's 6 honest men, and I think I mentioned before, the how's, the what's, the where's, the what, why's, the who's, always ask questions. Why are we doing this? What's the purpose of this? Again, as I said, you want nurses who are trailblazers, who are critical thinkers, who ask questions of, why are we given a second jab for COVID? Why am I told to give a third one to this person or a fourth one? Give me a few moments here. I want to go and do my research. Wouldn't it be wonderful to have nurses like that, rather than here you have to give jobs here, don't ask any questions. It's for the greater good. It's for the greater good. And we talked about before the hero complex. That one thing I don't like about nursing is it's nearly a protected profession, and I don't like the idea that it's immune to criticism. And nurses either it's through ego or insecurity. Nurses do like to tell people, always like to tell people they're nurses to get the plaudits, oh, you're a nurse, you must be so caring, and I always felt uncomfortable with that. Even as a student nurse, I'm going to veer off here, even as a student nurse being on a night out, the nurses would be the first people to tell people at the bar they're nurses, or to tell a crowd of other people they're a group. And I never liked that. I'd be thinking, if we were a postman, would we be telling people, oh, we're postmen? Or if we were working, do you know what I mean? There's an area, it's a bit egocentric. But
well, maybe we should start telling people we're podcasters. You could say, I'm Paul and I'm a podcast co-hoster.
Isn't there just a case sometimes of I think they believe their own hype as well. And I think we talked about the nudge unit, the Susan Michi, the nudge unit, getting the nurses on board by telling them they're wonderful, they're amazing. And in many ways, I feel sorry for nurses because a number was done on them as well, because they had to work as well during COVID, and I'm sure it was hard, let's be honest, having to mask up and wear the aprons day in, day out. Okay, but they're not getting their just rewards, are they? Because they've been forgotten now. They're not getting their demands, and they probably believed they were going to get their pay increase because they were told they were heroes and amazing and frontline workers, and you are angels of the health service. So in many ways, you have to kind of feel sorry for them in ways that, as I said, the authorities and bigger players
weaponize them.
On them.
Well, I think
they weaponize them, and unfortunately, nurses bought into it. So you can feel sorry for them up to a point that they're being used and abused, but then there's responsibility, individual responsibility, rather than the group nursing think.
I mean, I don't feel any more sorry for them than I do for any other profession, to be honest with you, Paul. I mean, I've worked in a lot of different sectors, and I'll tell you a story. I was working as a pizza delivery driver for a couple of years. Started it just around the time of the lockdowns until earlier this year. And I remember I used to laugh actually during the first lockdown, which really was very well adhered to. The roads were dead. The weather was gorgeous. The sun was beaming down. It was 22, 23 degrees. I'd be driving around in my car with the windows open, listening to the Smiths. And I'd have the radio on.
Oh, right.
I'd have the radio on sometimes, though, to listen to Greatest Hits or whatever. And to be told that I was working on the front line, you know, I was a frontline worker delivering pizzas, but of course, which used to make me laugh. Anyway, I'll come back to that in a minute. But as we know, the nurses, all that clapping for the NHS in the UK and the rainbow flags. Yeah, it was, but that was some sinister preemptive programming that they did both on the public to believe whatever they were told, and also on the nurses to commit some atrocious crimes. But going back to what I was saying about delivering the pizzas, fast forward to the end of 2020, last week of December 2020, between Christmas and New Year. The weather where I live near Liverpool, well, in the whole UK, was similar to what it is now. It was very, very cold. We'd had a little bit of snow, and the roads were like ice rinks. Except back then, they hadn't been gritted at all. Like literally, you were driving around on an ice rink, Paul. Yeah. And I'd been hearing all the time for the preceding 7 or 8 months how these nurses and doctors who were working on the COVID wards were heroes. Now, I thought that was bollocks for a number of reasons anyway. First of all, number one, you know, if you sign up to be a doctor or a nurse, you sign up to work during good times or during a pandemic. You know, that's 100%. It. It's not like, and you shouldn't expect praise to work when praise when you're working during a pandemic or an alleged pandemic. That was the first thing.
You know what comes with the job.
It all comes with the job. And the second thing I thought was, it's like a fireman saying, oh, you know, a big, massive, I don't know, the Grenfell Tower, for example, you know, well, they were heroes who went into there, Paul. They were heroes. You know what I mean? But it's like a fireman saying, you know, demanding extra money, demanding extra praise, you know, demanding media attention for going to deal with a fire. You know, nurses are there to work, to deal with ill people, whatever the disease is. So there was all this. Anyway, so there was all that preemptive propaganda going around. I think it conditioned the doctors and the nurses in the NHS to lull them into this psychosis to do literally whatever was asked of them. So go back to, I was delivering the pizzas late December 2020, early December 2021, and it was dangerous, Paul. It was dangerous. It was dark. It was freezing cold, and I was driving on icy roads, and there was traffic about them as well because the lockdowns. It was in the middle of a lockdown, but there was people out and about. It was terrifying going to work. I was working for £9.50 an hour, delivering pizzas, working under massive pressure, working for this, you know, corrupt corporate enterprise, which brings into question again what the nurses are saying about the money. Anyway, it got me thinking: who's in more danger here? Actually, these doctors and nurses working on the COVID ward, or is it me delivering these pizzas? I mean, let's think logically about this. Now, I didn't crash.
You're right.
And I did a video on it for my YouTube channel at the time, and it was entitled, "Are you sick of being lectured to by doctors, scientists, and journalists?" Where I just talked about what we're talking about now, Paul. And of course, it got taken down, didn't it? So I just thought that might be
there's a hierarchy of professions, isn't there?
Yeah.
There's a hierarchy of professions. You know, you didn't care about, as you said, the delivery man. You know, or it's
kind of penny.
It's very frustrating.
What would you say, Paul?
What I think? Sorry,
No, I was just going to ask you a question because you are a nurse. I was going to ask you, what are the qualities and the values that you would expect of somebody working in the medical profession, and does that tally with what we see generally?
I think what I've said already. I mean, it's. I think just to be caring and compassionate. I think you're just caring and compassionate. If you just have that soft-centered side and a bit of emotional intelligence as well, it goes a long, long way. And don't be selfish. It is the classic. Like I came from a nursing background. My father was a nurse, and he was a very caring and considerate man. So I always used to say, keep it simple with people and love people. Love your fellow human being. Treat them as if it's your granny or your brother or your sister or your mother. But don't patronize people either. And be an advocate, to be a true advocate for them. So again, I would say advocacy, as I said, be the eyes for the blind, be the ears for the deaf, be the helper for the helpless. I didn't see that the last 2-3 years. I saw a lot of healthcare staff, as I said, who went along with it, who towed the line, who forgot the true principles of what it means to be a nurse, who forgot maybe, who got wrapped up in the whole, as you said, the frontline hero complex. And they forgot the ethos of and the ethics of what it means to be a nurse. And in many ways, we've nearly went back as a profession, if not rather than progressing. You know, it could have been the making of nurses. As I said, look at all those thousands of nurses. Nurses could have came together, and doctors, and said, no, we are advocates for our patients. There's a lot of patients that we're not seeing that should be seen. As you said, the biggest C in the last 2-3 years was not COVID, it was cancer. And think of all those forgotten patients. And think of the lives that would be lost because of people we're never seen. And we'll never hear their story. And that's why nurses, we should have been advocates for these people. And we weren't. And it's a crying shame. But I think history will look back at this, hopefully. And I'm not here slating nursing, because there's wonderful nurses out there. But we have to talk that it was a dark time in our profession, you know, and I really think it was a dark time in our profession. And we need to be honest and open about it. We can't just try and erase the last 2-3 years, you know.
I was going to ask you, Paul, as well about the concept of institutional capture, because, you know, I have this theory that, you know, the long march through the institutions, you can't produce a health service that is, and I'm talking about my own country here, that is so inefficient, so corrupt, and so immoral. You can't produce one like that within even a decade. It's going to take a long time to happen. And I think in the same way that all of the other public institutions that are there to allegedly, you know, serve the public, the taxpayer, have been corrupted as well, clearly, as the private, you know, enterprises that hold way more power than any public enterprise. The long march through the institutions, for me, what does that mean? For me, that means putting in place the ideology, obviously the policy, the ideology, the recruitment, and then ultimately the individuals in place who are going to be sufficiently lacking in critical thinking, in self-awareness, in emotional intelligence, and in general intelligence as well. And I think that's where we've got to with the NHS in the UK. Now, I'm talking in terms of a systemic problem here. I'm not focusing on particular individuals, but what I will say is, in my own life, the people I know who are all of those things, who can ask questions, who are brave, who have identified values, who are that many of them are, or rather the ones who haven't, many of the ones who haven't done that, they work in the public sector, you know, where there's a job for life. There's an easy route into it if you just do what you're told. It's not particularly difficult to. I wanted to ask you, what is your thought on that theory?
Can you still hear me, Dave?
Yeah, still hear you, Paul.
I just want to go back to, I know we've only a few minutes left. You talked about the NHS and the history of the NHS, and you talk about the institutions that prop up the health service. I just want to briefly talk about our health service, the HSC. Obviously, the NHS goes back to the 1940s, 50s, doesn't it? It was kind of created kind of post-war.
48,
Our health service, 48. Our health service was created in the early 2000s, right? And we before the HSC was created in the early 2000s, we had a health service which was local health boards. So I'm from the Midlands, so you had the Midlands Health Board, and generally you had managers within that area that controlled everything, controlled the money, the finance aspect to it. So it was a little bit of autonomy, and it was generally well run. But then the health service then became under one big umbrella, and that's when it became definitely more corrupted and more negligent. And who was one of the founding members that created the HSC? He was Minister of Health at the time, Micheál Martin. Micheál Martin is our Prime Minister now.
And
there's been corruption, or there's been controversy after controversy after controversy within the HSC since it's been in situ since the early 2000s. It hasn't worked. It's been flawed. It needs to be scrapped in the morning. And the billions that's been thrown into it, that's been squandered. One thing about Micheál Martin, just when we're talking about healthcare, he was asked in Dáil Éireann, and this just shows the lack of, and again, I didn't mention that actually about nursing, the lack of empathy and compassion. You know, he was asked in Dáil Éireann, Micheál Martin, our leader, was asked in Dáil Éireann, I think it was by Peadar Tóibín, he used to be ex-Sinn Féin. He asked Martin about the cancer, people missing their cancer surgeries, and that it's a scandal. And Micheál Martin's response was, "Get real. Don't you know there's a pandemic?" That was his response. Very telling. So the leader of our country having that attitude, that will naturally just stem down. That was his attitude. That's what he said. Get real. Don't you know there's a pandemic? When a politician was just asking him about there's a crisis in cancer care with surgeries being cancelled and appointments being postponed, you know. So it filters down, doesn't it? If that's the attitude of our leader, that filters down into the health service. It gets into the psyche.
It does. It gets into the psyche, to the mentality, and into the culture. What one thing about the politicization of the NHS in my country, Paul, is for an outsider, from obviously not yourself, but from an outsider from, I don't know, another European country, why would they know anything about our health service and its political links? But they would surely find it absurd how the conversation through the NHS, it's never filtered through the lens of health. It's always filtered by the media through the lens of either money.
It's a brand, isn't it?
It's a brand.
The NHS is a brand.
It's a brand, so it's filtered through the lens of money or politics. That's it. And it needs to be reformed. I don't know to what. I don't know. It's a very, very complex situation, but it clearly isn't working. And there's this kind of like attitude still that prevails amongst people to too much of a degree that you touched on it earlier on. All doctors and nurses are saints, are heroes. I mean, what a load of bollocks. You know,
I know it is bollocks.
I support Everton, right? You know, If Everton won the, which they're not going to do, won the league, FA Cup, and Champions League, I still wouldn't say, oh, they're 11 heroes. I'll say I'd be glad they've won. It's like every single walk of life. You get good people, you get bad people. It's when you get the problem is when you get bad ideas. When you get bad ideas or bad ideologies that permeate an organisation and then infect the minds and souls and hearts of its workers, that's the problem. And that's what's happened, whether it's politics or whether it's corporate greed or whatever it is. So that's the problem.
It's like that letter I read out. You can't kill an idea, but ideas can kill you.
Absolutely, yeah. And didn't Carl Jung say, I think he said, people don't have ideas, ideas have people. And I think there's no more apt example. No more apt example of what's going on in public life, particularly in the NHS.
100%. I was just talking about the Irish Health Service and the history of the Irish Health Service. And this is something that's forgotten, and it's been purposely forgotten because of the hatred of Christianity and the hatred of the Catholic Church. And sometimes you have to acknowledge when good is done, but there's people out there that don't want to acknowledge any good that was done by the church. I mentioned Florence Nightingale there, and obviously Florence Nightingale came to prominence during the Crimean War, and it was just the Crimean War was one of the first wars where they really specialized in wound care and infection control. But Florence Nightingale was inspired by an Irish nun from the Sisters of Mercy, Sister Mary Clare Moore was her name, and that's who Florence Nightingale was inspired. But the Irish Health Service used to be run by the nuns. And my father trained under some of the nuns when he was a nurse, and he would say, you got away with nothing. They were sticklers. They were perfectionists. They were old style nurses, you know. they were specialized in wound care, infection control. There was no MRSA in the hospitals, and they ran the hospitals in the 20s, 30s, 40s, 50s, quietly went about their business.
Yeah.
No one acknowledges them now in Ireland. No one wants to go there because of maybe it's an anti-Catholic thing. And I think that's just another side. I'm kind of veering off there, but it's a shame, you know, that maybe we need that, you know, this, as you say, this whole kind of peace, love, and happiness, and everyone is all, you know, everyone's happy clappy in the health service, literally happy clappy. Maybe we need to go old style. I'm thinking even training, where we need battle axes training student nurses. Maybe sometimes the fearing God in student nurses, where they won't make mistakes, or they won't be cowardice, where there will be advocates, where they will question things, you know, rather than maybe weak, feeble nurses who go through the motions, you know. Maybe it's a reflection on society now, who knows.
No, that's a good angle, and it's a great story as well. And also something I wasn't aware of. As you know, Paul, I'm always fascinated by your country, by Ireland, because there's so much. I feel like it's a country I'll never ever begin to understand the dynamics of, and the demographics and the politics of it. It just absolutely fascinates me, Ireland, how complex it is. But I didn't know that. But just to finish off, I was. You know, I was talking to my mum actually, and I said you know what the NHS needs now more than ever. More than ever, what it needs is just nice people, right? Nice, you know, good, like good, you know, people with purpose and people with a heart to go into hospital, like a big recruitment campaign by the NHS. We need 10,000 people just to go into hospital and reassure people, make them a cup of tea, you know, make them comfortable, talk to them. Because
that's the basics.
Do the basics, because I see enough evidence that we haven't got enough of our nurses who are doing that, as much pressure as they may or may not be under. And I'm sorry I've come to that conclusion, but yeah,
No,
I'm gonna have to wind up.
The worst thing that ever happened nursing was,
just so
I know we have a minute left.
Yeah,
I'll just quickly say the worst thing that ever happened nursing was when it went university based. Nursing years ago used to be your training predominantly was in a hospital. You lived in the hospital.
Yeah.
You trained in the hospital. You worked in the hospital. It was like eat, sleep, drink, nursing. Now it's university based. It's no coincidence that things have just went downhill because when they've done that. Yeah.
I feel like we can carry on this conversation, but we've got another one coming up soon, haven't we, Paul? So I'll say bye to you, and I'll see you soon for the next one.
See you soon, yeah.
That was a great chat. Cheers, Paul.
Yeah, take care. God bless.
See you later. Bye-bye.